Welcome to Better Together. You are joining us for our 30th episode. In this episode, one of my favorites, Gwinnett, Newton, and Rockdale Health Department's District Health Director and CEO, Dr. Audrey Arona, is back here to talk seasonal health as we head into the fall and winter and give an update on what's going on with GNR and how that impacts our community. Let's jump right back in. After these last 2 years, I feel like you have become a household name. And we know, many of us know, you've given out your cell number to thousands of people. But you and your team have done an amazing job. When we think about everything that has happened with COVID and the pandemic, what have you learned about yourself that you didn't know prior to COVID-19?
Wow. Well, I can tell you that I'm so blessed to be working in a public health department, GNR, that has team players that have been here for years, right? A lot of my senior executives have been here for more 10, 15, 20 years. And so they have institutional knowledge, right? And they've been through Ebola and H1N1, and they've been through a lot of, not pandemics, but outbreaks and stuff. And so they know really how, the lessons learned in the past and, how to apply that to the current situations, right? So my superpower that I have discovered is I'm an active listener.
Wow.
I really am. And I think it's so important for a leader to be listening, especially to a workforce that's been there for quite a while, because they do have that essential institutional knowledge that is so critical to decisions that are made.
I think another one of your superpowers that you didn't ask me for, but I'm going to share, is that you are also a solution solver. Because just like you listen, you did something with it. You did not just listen and walked away and say, oh yeah, that's good. You came up, you and the team, came up with great solutions, and you partner so well with the county, and we are so grateful for that. So I'm going to add something, if you don't mind, to your superpower list, and say a solution solver. So what advice do you have for other leaders who must lead in times of crises?
That's a really great question, and the most powerful answer to that is the engagement and the intentional development of relationships with community partners. Because of our relationship, yours and mine, and Chairwoman Hendrickson and the other commissioners, we developed the largest mass vaccination site for COVID and the longest standing, right? And because of that relationship, we were able to really develop that big space and effectively deliver thousands of vaccines to our residents and other counties as well. And so, it's really important, community partners, just, nonprofits and our hospitals and our school system and, just a wide range of community partners is so important to develop those. And that's the richest way I believe that a leader can be as effective, especially in a crisis like this.
I totally agree. And on that note, I wanted to ask an additional question. As you know, that we are going through changes of deciding what we would do with the Gwinnett Place Mall. And currently, the vaccination site that you just mentioned, it was in one of the older buildings. That may not be available in the future. Do you think a county our size should have a place that if there was always an emergency, we can easily convert? And if so, what are your thoughts on that?
That's not a bad idea, and we definitely need to plan, for the future. We took Infinite Energy Center, which is now Gas South, convention, but we took their parking lot and basically developed that into the biggest drive-through testing site that we had. So again, I think, Gwinnett County is got a lot of space. It's got a lot of partners that are willing to jump in and help. So I don't know that we have to have a designated place. I think that what we do need to do is plan for something like this and have those relationships in place in case those areas are needed.
I think it's a great answer, because whatever we do, we need to make sure it's multifunctional, and we don't need to I don't think we need to carve out a space just in case and nothing ever happens. Right. We need to utilize every space that we have, because as you know, Gwinnett County is like 437 square miles, and we're not getting any more mileage or any more acres or anything in Gwinnett County. We have our designated boundaries. So the last time we spoke on the podcast, which was quite a while ago, We were in a different phase of the COVID-19 pandemic. You and your team, along with numerous volunteers, was building awareness about vaccinations and vaccinating thousands of Gwinnett residents. Where do we stand today in terms of COVID-19? And also when we think about the Omicron virus, because some people are thinking that maybe we phased out and we don't need to get any shots. But can you share some information?
Well, I'm happy to. So this is really important time right now. And I'm grateful that you asked that question, because as we're seeing COVID cases decrease, right, what's happening to the COVID-19 virus is that the virus itself is becoming more transmissible and less deadly. And that's what a typical virus will do, okay? Early on, that's not what we saw this virus do. But now that's what we're seeing. So, and it makes sense really, because from a biological standpoint, a virus doesn't want to kill its host because it wants that host to transmit the virus. So that's why we're seeing variants pop up and different things. So remember that our COVID vaccine, before the bivalent booster that's available now, is almost 2 years old, right? It'll be 2 years in December when we actually started being able to give it. And so it makes sense that we would have some breakthrough infections, right? Because it's 2 years old. So it's still very, very good at keeping people out of the hospital with severe disease and death, because again, most of the hospitalizations and deaths we're seeing are in the unvaccinated population, right? But what's special now is that the booster that they have now, called the bivalent booster, has added genetic material for the Omicron variant, right? So now if people get infected or come in contact with COVID that has the features of Omicron, this bivalent booster is going to provide much better immunity to that.
So is the bivalent booster then, is it available for all the age brackets the way that the COVID testing was? I mean, now do you have it in even for the young people, or? Right,
just within the last 2 or 3 days, it was finally authorized. Pfizer will be for 5 and older.
Okay.
And Moderna is for 6 and older.
Okay.
So it's the mRNA booster.
So this is the time of year that people are beginning to go and maybe get the flu vaccinations and stuff like that. And then we turn around and we have this one. Should we go and get everything at one time, or is it one thing that we just we just focus on just one of the different, I don't even know what to call it, so many vaccinations, or how should we look at it?
Right. Well, fortunately, we've had enough time to really look and see, since the COVID vaccine was available, we can now assess whether it's okay to give it with other vaccines or not. So yes, we highly encourage people to get their COVID booster with the bivalent booster, the newest one, and flu at the same time. You can get it in the same arm. You can get it on one in each arm. It doesn't matter. So, and any other vaccine you can get at the same time as well.
Now, I really haven't heard a campaign that's called bivalent. Will people know when they go to the pharmacist or they go to their doctors or wherever they may go get this particular vaccination? Do they know what to ask for, or is it automatic?
Well, it's good that you asked that, because the booster that's available now is only the bivalent.
Okay.
So, and that wasn't true before the youngest age was eligible. So now that the youngest age is eligible, then the only booster available now is the bivalent booster.
So if someone goes and they just ask for the latest booster, then they would get what they need and not anything that would be outdated.
Right, and the only caveat to that is you have to be fully vaccinated with the 2 initial first doses. You don't have to have had all the other boosters in between, but you have to have at least the first 2 shots of the other. And that makes sense because you're adding immunity to that.
Do you know whether or not, and we ran into this when we had COVID testing, do you know whether or not when anyone goes that they will be charged fully for this now because we're no longer under an emergency label, or do you know what's going on in that arena? So when people go, they're not surprised that they are charged $100 or something like that.
No, nobody should be charged for a booster at all. Okay. Other vaccines are different, of course, but the vaccine is still available under emergency use authorization.
Oh, yes. Okay.
It is, however, that's not what determines the price of it. It's actually because the federal government is supplying it, that it's a free resource to everyone.
So the federal government is still supplying the booster vaccination. Okay.
Right. So when and if it ever becomes available for purchase, that'll change. Because but right now, I mean, we do collect insurance for those people who have it for an administration fee. But if someone doesn't have insurance or they're underinsured, there's no cost to get the vaccine.
That's very important to know. So this summer it seems like another illness that came up that seemed like it was going to be a pandemic was the monkeypox. And of course that, as far as I know, didn't reach the levels that society, the CDC, thought it was. When we think about that, we thought about how COVID came up many years ago. Is it anything that we can look for this winter that will prepare us for maybe another type of illness or pandemic style illness that may pop up during the winter months?
Well, that's a great question. First of all, monkeypox is an example of what public health responds to in terms of an outbreak. And viruses are different, they behave different, they transmit differently, right? So COVID is very transmissible. You can be next to someone who sneezes and it's airborne in the market, that type of thing. Monkeypox was different. Monkeypox was a direct skin-to-skin contact with somebody with lesions. Ebola is a different thing now. We're looking at from Uganda, another, I don't know if you've heard about it, but a recent one with that's transmitted by body fluids. And so, the viruses are different. But going into the winter months, as you're talking about, we are very concerned about COVID rising because as the cold weather comes in, people tend to congregate, and that's what causes people, and with holidays and everything else, the transmission is higher. So in the Northeast and far west, we're already starting to see increased COVID numbers. So we really need to do a good job of pushing this latest booster, because I do think that we will see less breakthrough infections, and that's for infections seen in people who have already been vaccinated. With this new booster, because it has an Omicron adapted feature, then I think we'll see less breakthrough infections. And right now, as we know, that COVID loves to pick on older people like me. And so we're really trying to push vaccination in the populations that are most at risk. And so only 23% of our population in Georgia over 60 have gotten the booster already. So as we go into these winter months, we have to be cognizant that we're likely to see a rise in COVID again because of the cold weather, and this booster is perfect timing to try to fix that. We also have a big flu season. We also have RSV is already starting. That's respiratory syncytial virus. Right. Usually over 60,000 kids are usually admitted with that. There's no vaccine available for that. So again, this seasonal time with all of these flu, we just need to be careful, and we've all learned that washing your hands and covering your face, staying home when you're sick, all of that matters.
I know it's hard because my granddaughter actually had the RSP I think the latter part of the spring, and she ended up in the hospital, and she's 3 years old. So it's very hard for children under 5 to really not get something like that, because then they're constantly washing their hands, but they also constantly touching their nose and everything else because they're exploring.
Right.
And so is there anything that we can do to encourage, I guess, that younger population or either their caregivers on what they may be able to do in order to prevent that, or at least lower the cases of
Right.
RSP?
Absolutely, RSV, and it's like any virus. We saw it during COVID when everyone was wearing masks and washing hands and staying home when they were sick, and respiratory hygiene, different things, covering your mouth when you're coughing and all that. We saw that because our flu season, was really dramatically low. We didn't see a lot of cases the year that we were pushing all those mitigation measures for COVID. So yes, across the board, all the viruses that we see can do that. It used to be a sign of strength for people when they weren't feeling well to go to work anyway.
Yes.
Right? That used to be a sign of strength. And now it's flipped, because now that's a sign of respect.
Yes.
For coworkers, for, your children, your family, all that. So I think that one of the biggest things that we can do is just to stay home if you don't feel well.
That sounds good. So we're going to take a short break, and when we return, we will speak more with Dr. Arona. Thank you.
Thank you.
Hi, I'm Lauren Diaz with Gwinnett Communications. Residents are invited to pay tribute to veterans during the county's annual Veterans Day ceremony on Friday, November 11th at 11 a.m. at the Gwinnett Fallen Heroes Memorial in Lawrenceville. County Administrator Glenn Stevens will MC, the Gwinnett Board of Commissioners will provide remarks, and retired Army Colonel Dolores Hampton will serve as this year's keynote speaker. For those who cannot attend in person, the ceremony will stream live on Facebook and be available on TV Gwinnett and tvgwinnett.com following the ceremony. The Gwinnett Fallen Heroes Memorial is located on the grounds in the Gwinnett Justice and Administration Center in Lawrenceville. Now back to the conversation.
Thank you for those announcements. We are back with Dr. Arona, who has been just a blessing to our county and everything that we've gone through over the last couple of years. And so one of the questions that I would have, and I know people would ask me, and I don't know, but when we talk about the common cold, how would I differentiate that between a cold, the flu, COVID-19, the symptoms? Is there anything you can share?
Yes, absolutely. There are lots of tests that your doctor can do. And they can test for influenza, they can test for strep throat, they can test for, COVID. Of course, our health department has been giving out free COVID tests, home test kits for quite some time, and we still have some. So encourage people to stop by our health centers and pick up as many as they want because we're still doing that. But it's important to know what it is that you have. So in the past, if you just don't feel well, you stay home and that's fine. But, because COVID is so transmissible and you want to know what it is that you have. So do a home test, and if it's negative and you still feel worse, do another test, that type of thing. Or go to see your doctor and get a PCR test, a test for COVID that's more accurate than the home tests are, or influenza or strep or other things. And so, again, I think it's important to know what you have. So see your provider or, that type of thing, so that you know how to take. Basically, how you take care of yourself is the same, right? Mm-hmm. But it's important to know so that you can protect others around you.
Well, one last question regarding COVID. I know that the CDC had even changed once you expose, how long you are to be home. At one time it was 7 to 10 days and stuff. What's the latest on that? Because if we just want to know, because there was so many days out there, is there anything that has changed? Is it 5 days, 3 days? Is it 7 days? What is it?
Right. So it's right now it's 5 days, whether you're vaccinated or not. Once you start your symptoms and you're diagnosed later with COVID, like you do a home test maybe 3 or 4 days later, and it's positive, then you're isolated for 5 days from the start of your symptoms. Mm-hmm. So say you just did a test because you were concerned that you were exposed, and it turns up positive, but you don't have symptoms. Then it's 5 days from the date of that positive test, and then we caution people. You can go about your day and go back in the community and go back to work and that type of stuff. But I always encourage people, to wear a mask for an additional 5 days, just because some people will still be able to transmit.
All right, you heard her recommendation about wearing a mask. That's all I could say. But earlier this year, I had a personal friend, a close friend of mine, whose daughter died from fentanyl overdose right here in Gwinnett County, and it was such a tragic situation. And I know with GNR, the Gwinnett Newton Rockdale Health Department, I assume that you've seen a lot of cases and things like that may have come through. What can you share about GNR's work on that front when we start thinking about opioid overdose, because it is running rampant, and especially not only with our young people, but with all different ages, because my friend's daughter was like 41.
Right, it's really sad, and there's a protection risk for our law enforcement, officers as well. I mean, you just touch the fentanyl and it can create an overdose. So fentanyl is a real big problem in our country. As you've probably seen these articles about rainbow fentanyl, trying to draw our children. Mm-hmm. They look like little Skittles or little sweet tarts. Purple heroin. We see, different things like that. In Georgia, we've seen purple heroin. We haven't seen the rainbow fentanyl pills or anything yet, although yesterday I believe they found or within the last week, found a really, really big, large shipment in New York. So for Georgia, We've seen increased overdose cases in general, and fentanyl-linked cases as well, as you know, with your friend. So we're no exception, right? So our health department a few years ago hired a public health analyst specialist, a data specialist that works with OD map, which is a map to kind of locate where these overdoses are occurring, so that it helps law enforcement try to target areas that are highly affected by fentanyl substance, so that it'll hopefully lead to discovery of some of those places where it's being disseminated, right? We also recently got a SAMHSA grant, which is a substance abuse and mental health strategy to link our HIV services, which, you know, we're heavily involved with because we're one of the 57 jurisdictions in the country with the highest new HIV rates, right? And so that plus the substance abuse, this grant will help link those two services together to really provide education. So we're disseminating Narcan, we're working with law enforcement, mental health partners, also HIDA, and our overdose prevention recovery centers like Navigate Recovery, to try to train people and disseminate Narcan, which is the antidote. If you experience somebody and you think they're having an overdose, you administer Narcan, it can save their life.
Oh, wow.
So we're trying to get as much Narcan into the hands of our community as possible.
Now, Gwinnett County is part of a class action lawsuit against Big Pharma and things like that, dealing with opioids. It's public knowledge. There's not anything wrong with that. If you were to receive some funding from a grant once money is received, what would you use it for? Anything different than what you just stated? Is there anything dealing with opioid that we need to do more of? Is it education-wise, or what would you do if we had the money, and if the money came in and we were able to grant it to you, because we're not there yet by any means, what do you envision utilizing it for?
Well, a lot of things. First of all, we need to partner with our schools, because the parents and kids need to really understand this crisis and be fully aware of what's going on. So, you know, yes, engagement with the schools. I would like to see everyone in our community have Narcan on hand, right? Our law enforcement officers, of course, but everyone in our community to have this. And so the concept of having vending machines where people can go in, we're looking at having a vending machine for that type of thing in our health departments. So all we have to do is just give them a token, and they can get Narcan there. And again, working with GRIP programs, working with our jails, correction facilities to do that. Also, they have fentanyl test strips, which, which are really good. So say, you know that your child has, or not your child, but you know someone who's got a drug addiction, and you can use these strips to test the products before they're used. And so again, there's just a lot of initiatives that are across the country, I think, that we could implement locally and make a difference.
So we've talked about the COVID and flus, we've talked about opioids just now. I want to go a little further, push a little bit further, but another public health emergency, gun violence in relation to our children. Are there any thoughts from the GNR perspective on what you may be able to do, anything we need to do? And I'm saying that because when we think about the holidays coming up, recommendations, you know, that we can think about what we should tell our residents, how they should be more considerate and just thinking about what's in my household, how can I protect my family from some items here, whether it's cold or whether it's a gun that may not be stored. Is anything you can say about that, since it is considered a public health epidemic too?
No, it certainly is. And I think pushing education and awareness is huge. I remember in my practice when I was an OBGYN doctor before this role, I would talk to my patients, do you have guns in the house? Mm-hmm. That was one thing that we talked about. I think across the board, our community partners can help, even down to the level of our, pharmacies, our physicians' offices. I would like to see an advisory council put together in Gwinnett so that we can put our heads together to see how we can all implement things, because I just see from public health, from a physician standpoint, but there may be something you can think of, you're so creative, that you can think, well, what if we did it this way? And I just think it's time, and for the opioid epidemic too. And I know that we have a fatality review advisory council that's being formed right now for that. But I think it would be a really good thing to really coalesce a lot of community leaders together and put our thoughts together as to what we can do together collaboratively.
I think that's a really great idea, because one of the things we want to happen in Gwinnett County, we always say, and it sounds like a commercial, but we really want Gwinnett County to be a healthy county. And when we think healthy, sometimes think only physical, but we have to think about the overall health of the family, including what goes on, even mental health. You know, it's something that we can definitely talk with other leaders about. But I think it doesn't sound like there's any one issue that is greater than the other right now in Gwinnett County. But I would like to ask you just a little bit about infant mortality, because I know that is we have high numbers of that in Gwinnett County. Can you share a little bit about that before we close out?
Right, we do. We have assembled a healthcare roundtable in Gwinnett County, which are leaders, from all kinds of different aspects, including hospitals and nonprofits, foundations, of course, our medical providers and health department, community, counties, officials, different things. And we established 4 buckets of work where we felt like we needed to really target our efforts toward, right? Okay. And one of those was infant and maternal mortality. And that is a real problem, not just in Georgia, but in Gwinnett County, because Gwinnett County's numbers are higher than Georgia in general. And so, we're working with Audrey, which is a medical clinic, to provide more prenatal care and group, which has been shown. We're trying to use standards and things that have worked in the past, and evidence-based models that really seem to give impact. So we're working with WellRoot on providing, the pregnant patient who is low income and at risk for infant and maternal mortality, but we're wrapping around her with WellRoot services to offer home visits, and then that carries through until 2 years of age. Oh, wow. Right? So we're engaging with that group. There's been a lot of behind-the-scenes work on trying to promote safe sleep practices and some initiatives like that. I think COVID has just been such a name, and everyone's talking about COVID and different things, but there's been a lot of work in the background being done about those other things too now, but there's more to do.
Can you give just an example to our listening audience and myself? What is an example of a safe sleep habit? Because I haven't really heard that terminology. So what is an example of that? Like, what is an example of what would you do?
Right. So, first of all, the visits, pediatrician visits, of course, early on, and that, the best thing that we've done in Georgia has extended that postpartum Medicaid to a year. Mm-hmm. It used to be 6 weeks, yes, which is pathetic. And then we got it extended to 6 months, and then this year we got it extended to 12 months is really, really necessary. Okay, because then that first year is the most at risk for people for infant and maternal mortality. But safe sleep practices are, how do you position your child when you sleep? I mean, it used to be my grandmother's days, you put infants on their bellies, mm-hmm, and now it's not. Now it's, you put infants on their back to sleep, and you really be careful about comforters and blankets, and, we're trying to encourage people not to sleep with their infants, because that's a real common thing, right? And so, right, and so there's just a lot of those things that are done just habitually, that really there's a lot of education to provide.
Okay. Well, if our listeners have questions about anything we've discussed here, and we went from one end of the scale to the other, what's the best way for them to get more information?
Well, certainly go to our website, and I would love for you to put on this podcast at the bottom my cell phone number for everyone. I really don't mind. Most people have my cell phone number anyway. And, I think it's important when you have an issue to know where you can go for good information. And so I have no problem with people texting or calling me. The other thing is, the county website, your website. I mean, it's just amazing how much information is out there. But if you go to our GNR website, there's a number to call. You can reach a health department. All of our health centers, except for Buford location right now, are open. Okay. And so stop by the health center, anything you need, we're happy to help.
Thank you for returning to the show, Dr. Arona. This was very informative. We love the information that you always share. It's always a pleasure because we can walk away and we're not only informed, we know what next steps we can do, and that makes all the difference. So thank you so much.
You're so welcome. My pleasure.
It is clear that Dr. Arona and the wonderful staff at GNR are working each day to keep our community safe. To keep up with new podcast episodes, follow or subscribe on your favorite podcast platform or visit the podcast section on GwinnettCounty.com. You can also watch the video version of the podcast on TV Gwinnett and Vimeo. Until next time, always remember we're much better working together.